Morning, everybody. Pleased to have Dr. Brent Roussin with me today. Not as pleased as I normally am. I understand he's going to be giving me some pain later on, but I look forward to that. This year has been like no other. COVID has handed us new challenges, even greater ones than Manitoba's faced before. COVID nous a lancé de nouveaux défis et des défis encore plus grands qu'auparavant. Yet this year has shown Manitobans at their finest. You've made personal and professional sacrifices. You've gone above and beyond to protect yourselves, your loved ones, your community, your province. You've heeded the advice of Dr. Roussin and our healthcare experts, and that has helped to limit the spread of COVID-19 in our communities and has helped, for the most part, to lessen the impact on our healthcare system as well, and we need to keep doing that. As we see a surge in COVID cases now, it is crucial that we remember to follow the fundamentals. When we followed the fundamentals, we were winning against COVID. When we fail to follow the fundamentals, we begin to lose. We need to get back to winning. We need to get back to the fundamentals here in Manitoba. We need to stay home when you're sick. Wash your hands. Practice good hygiene. Cover your cough. Practice physical distancing. Wear a mask. Limit your gatherings. And now more than ever, get your flu shot. And as we prepare to deal with the flu season and COVID at the same time, it's never been more important for Manitobans to get a flu shot. We all have a role to play in protecting our most vulnerable citizens in our healthcare system so that it's there for us when we need it the most. The flu vaccine prevents us from serious illness. The flu vaccine saves lives too. Le vaccin contre la grippe nous protège des maladies graves. Le vaccin contre la grippe sauve la vie. The flu vaccine is available to all Manitobans at no charge. And I am pleased to say that the eligibility criteria for the high-dose seasonal influenza vaccine has been expanded to include not only senior residents of long-term care facilities, but many other Manitobans over 65 years of age. To get your free flu shot, I encourage Manitobans to visit their family physician's office, their local pharmacy, access center, local public office, nursing station, or an immunization clinic near you. Manitobans have a long and proud history of taking care of one another and of facing our challenges together. That's what the flu shot will help us do. It works. It protects each of us. It protects our family, our friends, our fellow Manitobans, and now more than ever, get your flu shot. Maintenant plus que jamais, faites-vous vacciner contre la grippe. I want to thank Dr. Roussin again for joining me here today and demonstrating how simple and easy it is to get your shot. Before I get my shot, Dr. Roussin and I would be happy to take any questions that the media might have. And as soon as we're done, I guess I'll go and get a flu shot.
I was just wondering, we've seen in other jurisdictions a heightened demand for flu shots. Can you tell us what percentage of the normal
Right. Yeah, so we're anticipating an increase demand this year. We've ordered 20% more than we did last year. Last year we hit our record seasonal uptake at 26%. So we've ordered 20% more this year, and then we'll monitor the demand.
So that's 20% more than normal, or 20% more than the record last year?
Well, last year was the normal amount we ordered typically. We order a typical amount. This year's 20% more. Yeah, well, it's roughly 40% of the population. Well, the approach is we have a multifaceted approach. We have a blended approach. So like the Premier is saying, physicians, pharmacists, public health nurses, various clinics can offer it, and so each of those clinics are already made changes to ensure there's distancing, make sure there's screening for people at risk. So we think we're going to meet the demand, and we're looking for Manitobans to get that shot this year.
With the 20% increase, what percentage of the population could you?
It's roughly 40%. Roughly there, yes. Well, the vaccine's procured nationally, so we're looking at that. We're going to see what that demand is. So in pandemic year 2009, H1N1, we got to the high 30s uptake, and we're expecting at least the same. Let's run regionally. Like I say, we have a blended model. So just like we have many pharmacies, many doctors' offices ordering vaccine, same amounts that we've seen in the past. And then public health in the regions will be developing their own strategies if they have clinics to target, whether it's mass clinics or whether they target vulnerable populations. Well, I think that being in a pandemic helps this campaign out quite a bit. I think people are very concerned about circulating viruses this year. We know we're dealing with COVID. We're likely going to have to deal with influenza on top of COVID. So we've got to do what we can to limit that burden of respiratory illness this year. And the fundamentals for sure. But on top of that, now we have another tool, there's the flu shot. Yeah, we've shipped out close to 150,000 doses already, and so it's making its way into doctors' offices and pharmacists as we speak. Yeah, right now I think we have our orders in through injection right now. We can update if we get our hands on flu mist or not. Well, because we have many shipping points that we get to, so in no year have we been able to ship out to everyone at once. So we do it over a scheduled, a rotating schedule year after year, and so some are starting to receive it now, and others will receive it over the next many weeks. Well, the process works as a complex system, and it's very streamlined every year. So we'll get those doses out as quick as we can. Yeah, so we've doubled our order of high-dose influenza shot this year, and so we do have, we've broadened the indications for receiving it through our influenza program. So anyone living in admitted to a long-term care facility or assisted living or on a wait list receiving home care into that's been expanded. 65 years and up above the 53rd parallel are eligible, and 65 and up on First Nations are eligible. So we've expanded that. So most of those, in the city here are dealt with through the facilities that those people are admitted to.
So 65-year-olds still living at home, not going to a home anytime soon, they're not able to get the shot?
They wouldn't be eligible to have it covered under our program. They should get the seasonal influenza shot. There may be access at certain pharmacies. Pharmacies may order that, but we procure it nationally, so I can't really comment on that.
So the premier would be getting the seasonal?
That's correct. This year. Mm-hmm. Yeah, I don't know the specifics. We usually try to order for about 30%, about 30% to a third of the population. Well, we're not expecting a shortage. We're going to certainly work on watch that demand. We do prioritize the high-risk groups, so that first priority group, long-term care facilities, First Nations, healthcare institutions, they get the priority doses. So those are already out the door. No, not mandatory. We're like the Premier said, we all got to do our part, and we have to protect our patients. So we're really encouraging everyone to step up this year. Yeah, so you definitely are not going to get sick from the flu shot. Flu shot is very safe, very effective. It's in fact our safest and most effective way to protect ourselves against the flu. It's not going to protect us against COVID, but with very likely we're going to see both of these viruses circulating at the same time. So we need to do what we can to limit the impact of them.
I know you're very convinced that a greater proportion of the population will actually get the flu shot, 26%, which was a high over the last few years. That's still very low. Are you convinced that people are actually going to get the flu shot this year more than
I think demand will be higher this year. We're certainly expecting that, when we're prepared for that. So we're trying to get the message out. I think people know how important it is this year to do that.
Bill 16, the bill yesterday is very different from the one in the spring.
There's a lot of bills there, Steve. You're going to have to outline for me the title of the bill.
Sorry, it's the Labor Relations Amendment Act.
I see.
It does away with a number of things, including binding arbitration, subsequent collective agreements. It makes it easier to fire a striking worker. What prompted these changes? And you're being accused by some of your opponents of tilting the table in favor of employees.
No, I think we're tilting the table back to balance. I think the system that we inherited was biased one direction, so we're looking to make it more equitable and fair. And I would mention on the flu shot that getting it early means obviously getting it to prevent getting the flu. It'll be too late once you have it. And so I'd urge Manitobans to take action on that, not to wait until there's a problem, but rather to solve it in advance. So I just encourage, that's what we're trying to do as a government as much as possible. I'd encourage everyone in Manitoba to do the same. Well, we're doing a number of things actually, and Brent will have more to say on some details around some of the extra preparatory work and preventative work that we've been discussing in the last few days, probably as early as tomorrow. We've continued to step up in respect of every aspect of this, beginning with preventative work in terms of our ad campaign, and looking to expand on that. To encourage in particular, I think now the younger cohort, which appears to be the fastest growing number of cases, to do the right thing, and I would urge all young Manitobans to understand that they are powerful. They have the opportunity to do the right thing and prevent COVID from affecting them, but they also have the opportunity to save lives. They have the opportunity to make sure that their grandmother or their niece doesn't get COVID. And that is really, really an important responsibility, and I encourage all young people in our province to step up and do their part. And I would say also, obviously, we're always concerned when we see a higher number of cases, but I wasn't joyful when we had none, and I'm not going to be sorrowful that we have many now. I think that the fundamentals are what we always have advocated, and when we followed those fundamentals as a province, we were doing really well. And when some of us forgot about those fundamentals, we stopped doing really well. We were winning. Now we're losing. If you want to get back to winning, and I think all of us should, get back to the fundamentals and follow the fundamentals. We're in this together. We need to encourage and support one another in this. This isn't about shaming or being cynical towards anybody, but it is about making sure that we support one another, we're kind to one another, we educate one another, and we do everything in our power to make sure that we're protecting one another at this critical time.